There you go.
Hi, my name is Renee Sisson. I am a recent graduate from the Master's Program for Counseling and Marriage Family Therapy at San Francisco State University.
Awesome. Well, thank you for meeting with me today. So, as we talk about the universal medical language in my research thesis, do you have any relations that you can bring from your field into the topic?
Yeah, I was immediately reminded of the situation as Savannah was telling me about the separation between the global, international versus local, dealing with the language barrier. And in the mental health field, we use a diagnostic statistical manual, and there's also that's for the United States, but then there's the ICD, which is the International Classification of Diseases. And recently, of course, I'm not working right now, just graduated, like I said, but in our field, they've introduced to us instead, additionally now, when we do a diagnosis, we put the diagnosis from the DSM and as well as from the ICD. And so, when this is, say a patient goes to another country, then whatever mental health profession they're working with will be able to reference. And there's a whole system that's already in place where they can just reference and see exactly what the diagnosis was in the country of origin.
Right.
So I was thinking that falling somewhere along the lines of Savannah's research.
Okay. And so, just for the video, just for clarification, we were talking earlier, and we were talking about how not necessarily do we think English, it's likely that it could be a universal medical language, but that there could be steps taken to close the language barrier in that aspect. Like, instead of making everyone learn English, that's not a likely thing, you were saying, but because everyone is so different, we could provide, different options to help people and patients, like you were talking about in San Francisco, how doctors know different languages and they can communicate with each other. Even though they've learned English, they're still fluent. They're not as fluent as they, can be after years of living there. So not necessarily do we need to change a universal medical language, but we need to change how we're communicating with each other and steps towards that, right?
Yeah, and that's what I was telling her, San Francisco, like, I'm with a Kaiser Permanente, my personal health insurance. And when I go through research and looking for choosing my doctor, I don't even, there's so many to choose from, so many different nationalities, and they'll have listed like 3 or 4 languages that they speak, And so I don't know if they learned English, they're American born and learned English, but they're, we all know it's common knowledge that most countries do teach English, even in elementary schools, the children coming up, because it is pretty much accepted as a universal language.
Right. So maybe instead of acting like different languages is a language barrier, we could use having a melting pot of languages in America, even across the country, as an advantage, and allowing everyone to feel comfortable, but allowing them resources to do so without having fatal mistakes, miscommunication, and terminology differences.
Yeah, and used to, it seems like we have to make a decision in either or, but now the word is and.
Right.
Again, I'm just referring to San Francisco. I've lived there, for about 9 years, in California for 30. So, I grew up here in Mississippi. Not a lot of language. I did speak Spanish in high school, but the pamphlets, the literature, there's just language everywhere. It's accessible. So, and it's not just for the doctors, but you have so many nationalities who are living in these cities. Even even Mississippi has fundamentally changed a lot after Hurricane Katrina. A lot of the Hispanic population here, you've got a lot of Spanish language, and we've always had, the Vietnamese and whatnot. So it's for the people as well, you know, so making medical things accessible in several different languages and just, blended it all together.
Right, awesome. Well, I appreciate your time, and I thank you for talking to me.
And good luck with you, ma'am.
Thank you.